Hi there, it's Kathy again, and welcome to a series I'm going to be posting videos on from time to time called Take It Back. This one is on Take It Back Home Care and how to build a home care plan that works for you. You know, for decades, I worked inside the home care system, building agencies, training caregivers, creating hundreds of personalized care plans, and consulting on complex cases for families and state-driven programs. I've also walked the path as a family caregiver, experiencing firsthand the emotional, the financial, and the logistical struggles that come with caring for a loved one. So I know what works, what fails, and what we as families don't even know to ask. Here's the hard truth, the government, as you're seeing, won't save you. Healthcare and home care programs are being cut left and right. Costs are skyrocketing and caregivers are in short supply. Agencies are overwhelmed, often impersonal and definitely inconsistent. Families pay top dollar only to get unpredictable, unreliable care. So, this leaves us, an elder, a loved one, vulnerable. And again, no one's coming to fix it. So it's time to stop waiting. It's time to take it back. You can build your own home care system, one that is compassionate and consistent and affordable. With the right plan, you can hire directly. You can integrate state supports, you can integrate technologies, you can even work with agencies and pull it all together on your own terms. This is what we ended up doing as a family years ago. So, I'm going to go through how to set up a workable and practical plan of care for you, for your family, or for anyone you know and care about. Below, I've included links to two other videos. One is on how to negotiate contracts with agencies and caregivers, agencies and or caregivers, and how to get paid by your state's Medicaid program to provide care for a family member. So let's get started. Alrighty. So the first thing we need to do is get clear on what we want. Can't get there if you're not clear. Before hiring anyone or asking for help, define exactly what care is needed. So we look at things like personal care needs. Personal care needs includes things on our body: bathing, dressing, toileting, eating, walking. Identify high-risk areas like transfers, especially if they include some kind of lift. Next, look at household supports: cooking, cleaning, errands, transportation, medication, either reminders or management. Then think of how complex is the medication program, the management. Mismanagement of medications is the number one reason people end up in the hospital. Along that line, look at medical needs. Does someone need wound care, diabetes management? Is there a diagnosis of dementia, or is Parkinsonian support needed? Often it's not just one condition. What are the emotional and social needs? Companionship, conversation, engagement, routine, purpose. The thing here to remember is to keep it simple. Checklist, a one-page checklist, as a reference for everyone involved. You can digitalize it, share it, put it up on a shared document. This is a foundation that prevents confusion and sets expectations and allows you or your family to evaluate the effectiveness of your plan, which is our next area, which is to take that list and build it into a personalized care plan. From a simple list to a simple plan. This written plan turns chaos into consistency, which is so important. So you begin basic details. Name. Who does the person like to be called? What does the person like to be called? The age, medications, diagnosis. All these practical things, as well as a list of health care providers. Routines, wake up, meals, bedtime, preferences, foods, hobbies, spiritual, cultural needs, safety notes such as fall risk, allergies, home hazards. Goals, most often, is to maintain independence, reduce hospital and unplanned visits, and improve comfort and engagement. So post your plan or the plan at home and review it periodically, however often you think you need to, but at least monthly, an update is needed. This care plan is the heartbeat of the whole system. Whether you hire directly, whether you use an agency, or whether you do it yourself. So let's kind of look at the differences here. If you choose to hire directly, check out the caregiver. What do I mean by that? Check references. Always speak to prior employers or families, people who understand the reliability, communication, and professionalism. Don't ask a relative. Ask specific questions about the punctuality, attention to detail, and challenges that were faced and overcome. Next, look at background checks, criminal history. This is key. Use state or national criminal background check services if you want to ensure, because you want to ensure, there are no violent offenses, fraud, or theft convictions, right? Look at sex offender registries, national and state databases. If driving is involved, check the driving record. If your caregiver is going to transport your loved one, request a copy of their driving record or use an online DMV service. Look for accidents, suspensions, or any other violations that might indicate unsafe driving. Identity verification, very front and center right now. Confirm legal name, date of birth, and work eligibility. Begin with a trial shift. Start short, paid trial shift to observe how the interaction is with your loved one. Follow instructions. It's kind of like, what do they call a probation period we used to do years ago. Remember, trust and communication are more important than paperwork. See how it actually works out in the home. So here's a tip. Keep a file with all the reference and background checks and trial shifts and all your notes, and this protects you and ensures accountability. Keep any valuable items and cash out of sight, stored separately, and if you can, off the premises to avoid any temptation. It does happen. I'm here to tell you. Pay fairly. This helps to build loyalty and trust. Direct hiring benefits everyone. It did for our family. So instead of paying an agency $45 an hour, you can pay $22 to $25 an hour and give it to the caregiver directly. They earn more, you save more, and reliability improves. Keep your good caregivers. You may get down, we got down to one or two, because we had high hours. Offer steady hours, timely pay, and appreciation. Don't let sticker price dictate your family's care, okay? If it's too high, it means you need to look somewhere else. Next, create consistently and backup plans. Things happen. Reliability is everything. And as I was mentioning, a small team of 2, maybe 3 caregivers who know how to plan and can cover for each other and post schedules that are cross-trained and designate a trusted backup for emergencies. With our family, we always covered the holidays, which worked well for our caregivers because then they got to spend the holidays with their families. You can also use community resource and technology integrated. One doesn't have to be in place of the other. You can use many of these together. Remember, you don't have to go it alone. Combine the private care with the community support, such as Meals on Wheels, an adult day health program, which is the best for the money. Senior centers, volunteers, visitors. Medication reminders, fall detection devices, video check-ins or video monitoring, a lot more families are using. Shared scheduling apps for others in the families who may or may not live nearby. These are tools and approaches that make care safer, smoother, and more coordinated for you and everybody. And know it's important that things change again, stuff happens, and care needs do evolve. Make sure that what you set up still fits. Adjust it, and let family members be included, those that want to be. As we all know, not everybody wants to be. Know that your plan is a living document and adapt it as you go. Now, I want to share one thing with you. If this is your only takeaway, it's worth it. Never, ever, ever, ever give power of attorney, healthcare power of attorney, financial power of attorney to any caregivers. Their role is to provide care, not to control anything. Powers of attorney for finances and healthcare should remain with a trusted family member, friend, or legal representatives. Boundaries protect everyone. Please remember this. So maybe you don't want to hire privately. Maybe you want to use a home care agency, or maybe you want to integrate a few of the things we talked about. So if you choose to work with a home care agency, remember this: your family, you are in charge. Always, always, always. Agencies can provide the vetted staff and backup coverage and insurance, but know that they are there to assist you and support your care plan, not replace it. You have the right to choose caregivers who match up or compatible with your loved one's personalities, abilities, and preferences. Do not accept whoever the agency assigns. You do not have to. Do not let an agency take over your decision-making and ask questions such as, how much of the hourly rate I'm paying actually goes to the caregiver? How much is overhead, administration, profit? If you're paying up to $50 an hour, which is what some people pay, you have options. You have options at any rate, but the more money you pay, the more questions you should ask. You do not have to accept a random assignment. So compare cost, negotiate when possible, and assist on transparency. I have a separate video on negotiation. You can even hire a caregiver directly if they meet your standards, saving money while retaining the same talent. Yes, many agencies have papers to sign for this, but, another video. Orientation is essential. When agency staff come in, who will walk them through the care plan routines, safety procedures, and your loved one's preferences? Initially, it's probably you, but if replacements and there's inconsistency, who's doing this? Ensure that they train their caregivers and that these caregivers have the experience to care for your loved one. This is especially true with complex care needs such as COPD or dementia care. Frequent check-ins ensure that they follow your plan, not the default plan set by an agency. I've seen agency plans that are years and years old, never been updated. So you've got to take it back. If you feel uncertain about where to start, begin with an independent evaluations or discussions or guidance from a credentialed RN, social worker. Remember, many free consultations come with hidden commissions or referral biases. You want to get a low-cost, unbiased review of your health, finances, legal needs, care options to give you clarity without any pressure. Knowing what you don't know is power, and it allows you to compare agency offerings, negotiate intelligently, and ensure your loved one's care is safe, consistent, and most of all today, affordable. Agencies cannot solve instability. No one can fix what's going on all around us. Only you can take it back as it relates to your situation. So build something. Build a care system that's personal, consistent, affordable, and dignified. Define the needs first. What is it you need, want? Write up a simple plan of care. Hire compassionate caregivers, whether individual or through an agency. Pay fair, keep loyalty, use community resources, think about technology and adapt to needs as they change, and stop waiting for this broken system to save you. Take back your own home care experience, build it, own it, make it human, make it compassionate, and make it entirely yours.